Well, you can start.
We have a T here today who will undergo a hair transplant, and we are trying to do the FUE technique, which means that we'll collect individual hair from the back, which is our donor area, and transplant it to the front to create a nice female front line. Also, T has lost some hair in the what we call the central D portion, and this is something that we would like to thicken and replace the sort of the volume that's been lost. We're going to start by drawing the front line, and we're going to ask T if she likes what we've drawn, and then it takes a little while until we are all happy with the front line, because most of all the patient has to be happy with the front line, and the front line is permanent once we reconstruct it from the back, because the hair taken from the back of the head is stable, it will not fall. Of course, the patient's own hair may continue to shed, but we have discussed that already with T, and she's going to consider some methods of prevention in future, because she has got a strong family history of hair loss. Let's start by drawing the front line. We're going to be going no further down from the existing front line. Vertically, the face should have 3 equal thirds from the front line to the eyebrows. That should equal the length of the nose and nose to chin, which is perfectly harmonized in a T's case. I'm going to start from the middle because this is our lowest point, and we're going to continue and try to join the middle to the sides. And of course, this is how we create a female hairline. Obviously, if it is a male hairline, it will be a different shape. This is the area that I'm going to ask T to look and see how she likes it. And then once we agree and we're happy, then we will proceed to making this line permanent.
Thank you.
And then again, we're checking, we're going to ask T to raise her eyebrows. So we might have to, you see T, where your last, when you raise your eyebrows, see, she's got some movement, she's got some, in fact, the muscle goes quite high here.
Yeah,
T, if you, yes, technically, we cannot be really too much above the, because otherwise, every time you raise your eyebrows, your hairline's going to move with that. So we've got to be...
Just that, yeah, okay, I see.
But we need to, but then we have to sort of join it in a better way, something more like that. Can I have alcohol? That's better.
Is that, yeah?
I think so, because otherwise you're going to have that movement of the front line every time you raise your eyebrows.
That looks, okay.
So we could join it a little bit better this way, like this.
And then there'll still be that bit there as well.
Yeah.
Okay, that's what we said before.
Unless you want your party trick of moving your hairline with your eyebrow.
No, not particularly.
No.
I think that's pretty much
Imagine if that's all hair. I don't know how you can imagine that. Yeah. It's all hair like that, and that will grow down as well. If you are you gonna have your hair long?
Probably, hopefully.
Yeah. How like long?
Whatever I can do.
Yeah. Well, then you can do all sorts with it. Yeah. Would you ever wear it off your face like that?
Probably.
Would you? Okay.
If from your experience that is quite a good line, then I don't really know.
This is a female hairline.
Cool, yeah. Thank you. We've
done no recesses, and like I said, this line will be permanent.
Yeah,
well, we need to obviously make sure that you don't lose any more hair.
Hopefully, because my dad's stopped here as well, and this I don't think this is moved for about 5 years now, maybe more. So hopefully that's it.
Remind me, how old are you?